to educate the community better with oral screenings because the demographics for oral cancer has completely changed. Oral cancers were basically 50 and above. You had to have been a smoker, drinker, high, alcohol consumption, tobacco use. That's not the case anymore. That's what I was explaining to my patient, is the human papillomavirus has become very rampant. And that is also what's made the oral cancers even become more aggressive, and they're becoming in a much younger age. So even as young as 13 and 14, you can screen for oral cancers now because just our whole lifestyles have changed.
We're doing free cancer screenings for donation. It's all the proceeds are going to the Scott and White cancer research. What we do is we are looking for any abnormal cells in the mouth. If we can catch oral cancer at an earlier level, it's almost 80 to 90% curable. Usually by the time we clinically see a lesion, you're already at a stage 3, stage 4 cancer. At that point, it's either terminal cancer or it's going to be reconstruction surgery, either losing part of your jaw, part of your tongue at that point. So if we catch it early enough, we can remove the abnormal cells before they ever turn into cancer cells. So we look mainly around the tongue. Tongue's a very common spot. Anywhere saliva pools is a very, very common spot for oral cancer. You look for like a red, white lesion that doesn't go away in about 2 weeks. Any kind of abnormal, anything abnormal won't heal. Ulcers, scratches, tissue trauma will usually heal in about 2 weeks.
It's a safety precaution, yeah. The dentist said that everything was clear, no sign of any, tissues or anything that looked pre-cancerous or cancerous.
Or in America, you can say there's at least 50,000 head and neck cancers that are diagnosed each year. And 27% of those are oral cancers that are people that are diagnosed that have no known factors for risk. They're not smokers, they're not drinkers. So I think it's out there, it's just not well known at this point, and we hope to educate people so they know to actually ask for these processes and make sure they're well and healthy.